If you've ever gotten the flu, how long did it take you to get diagnosed and treated? Did they give you something like this? Extensive research should be done on ADHD in women so that doctors can diagnose and treat them as quickly as they diagnose and treat men. This research could help many women have a better quality of life. It took 2 different doctors and 18 years of struggling for me to get diagnosed and treated, and this is what has drastically improved my quality of life. Knowing how ADHD presents itself in women and what the effects of it are is key to the development of better health care for women with the disorder. There are a few facts to know about women with ADHD. The first one, ADHD presents itself differently in males and females. According to an article in the Journal of Psychopathology and Behavioral Assessment, ADHD during childhood is 2 to 9 times more likely to occur in males than in females. Although much research has been conducted on ADHD, it is almost exclusively focused on males. Females with ADHD present with more depressive symptoms, more problems with family and peers, and lower levels of academic achievement compared to females without ADHD. They also present with less hyperactivity and greater cognitive impairment than males with ADHD. Females with ADHD experience more severe internalizing problems like anxiety and depression and have shown greater relationship difficulties compared to males with ADHD. Recent studies on adult women with ADHD hypothesized that they would experience more internalizing relationship, academic, vocational, substance abuse, and delinquency problems. All of these issues that women and men with ADHD face are linked to low academic, social, and professional success. They're even linked to a higher suicide rate. According to the ADHD report, interpersonal relationships, establishing a steady romantic relationship, and becoming a parent are more strongly tied to well-being in women than men. Thus, while both males and females with ADHD experience difficulties in these areas, the consequences of these difficulties affect women more strongly than they affect men. In a study conducted on married couples, some having one partner with a clinical diagnosis and some having none, nearly 60% of non-ADHD men left their female partners with ADHD, while only 10% of non-ADHD women left their male partners with ADHD. This suggests that ADHD affects both partners more when the female has a diagnosis. Although it's uncommon for adults to present with the same hyperactivity and impulsivity that children present with, given that those decrease with age, there is still a tendency for college students with ADHD to experience learning challenges related to inattention, such as distractibility during class, difficulty completing assignments on time, and disorganization. Academic underachievement is also a factor that contributes to adults with ADHD struggling at work. In a longitudinal study that examined the vocational performance of adults with ADHD, it was reported that they tend to be employed in lower ranking occupations and are more likely to be dismissed or terminated from employment than people without ADHD. Due to the impulsiveness, inability to regulate emotions, and increased threat of major depressive disorder in persons with ADHD, they're at a higher risk of committing suicide. These are just a few of the ways that ADHD affects adult life. The struggles that women with ADHD face are enormous. Extensive research could lead to an increased diagnostic rate, which in turn would lead to effective treatment and a better quality of life for women with ADHD. Studying ADHD in women, the way symptoms present, and what the effects of them are is important to the growth and development in healthcare for women. Maybe with that knowledge, women can get diagnosed and treated for ADHD as quickly as men, or as quickly as they get diagnosed and treated for the flu.